Hi, my name is Kira Hurt, and this is my program evaluation presentation. It is on the Salvation Army's Client Choice Food Pantry Improvement Plan and Evaluation. Food is a basic need of all human beings for survival. Poor nutrition and inadequate access to food can be very detrimental to people. Nutrition is vital for good physical and mental health. There are over 40 food banks in Ada County to feed the food insecure. The Salvation Army's Client Food Choice Pantry is one of the many food banks in Ada County. The pantry serves between 500 and 700 low-income individuals and families each month. The Salvation Army became the largest client food choice pantry in the county when it was at its former location on State Street. However, at the new Emerald Building Street location, because of the limited space, food boxes are prepackaged by staff and volunteers. Each box contains the food pyramid, which is a protein, a whole grain, fruits, vegetables, meat, and dairy. The number of people coming for food boxes has been increasing steadily in the last year, especially since January. Having a suboptimal diet has been shown to increase the risk of obesity and diseases such as cancer, cardiovascular disease, and diabetes. It is vital that, along with Supplemental Nutrition Assistance Program SNAP, that we also have food pantries available for those who need to supplement SNAP or do not qualify for SNAP but remain food insecure. The program is designed to serve low-income individuals and families, regardless if they qualify for SNAP. However, since the COVID-19 pandemic, anyone can receive a food box if they are a resident of Ada County. People can use the food pantry one time per month. The food pantry is open Tuesday through Thursday from noon to 4 and on Fridays from 10 to 1. So it is closed on weekends, holidays, and Mondays, which leaves people not able to access it many times of the week, the month, the year. The food boxes are acquired by going through a drive-through in their vehicle. The current Salvation Army on Emerald Street was not adequately built with enough space for a proper client choice food pantry model. This is one of the reasons that it is a drive-through and why I am working on this improvement plan. There are future plans to build a separate building to house the food pantry, which will have much more space than it currently does. With the additional space, the program can go back to being an actual proper client choice model rather than having the pre-packaged boxes. There are 2 full-time staff and 1 part-time staff who work in the food pantry. The pantry is reliant upon volunteers to effectively fill and distribute boxes. The staff members go out in the morning and they pick up food from the Idaho Food Bank and several participating grocery stores. Research has found that the top barriers to implementing the client choice model are related to pantry space on location at 37%, volunteer and staffing needs at 35%, lack of awareness concerning client choice options at 28%, COVID-19 concerns were 27%, and perceived client greed and client distrust was 12%. Food-related stress is one of the top concerns for individuals and families who are low income. Food insecurity is associated with diminished psychological coping resources, which leads to greater psychological distress. The Salvation Army is a nonprofit organization whose purpose is to assist the needy, poor, marginalized, and oppressed without discrimination. The Corps has several programs such as the Client Choice Food Pantry, seasonal programs, the Booth Program, Cardinal Academy, a high school, Project Share, a gymnasium, Vacation Bible School, and the Pathway of Hope program. The goal of the Boise Corps is to be a welcoming, informative, and supportive community under one roof to serve the people of Ada County. The Salvation Army Boise provides food boxes, energy assistance, education for pregnant and parenting young people, and case management for the students of Cardinal Academy and the clients in the Pathway of Hope program. We also offer pastoral care and sports clubs for low-income children and adolescents. The Salvation Army's Client Choice Food Pantry is one of the main programs that brings people to the building. By improving the Client Choice Food Pantry program, it will allow more space for storage and distribution, and allow more clients to receive food boxes, and make it more accessible for people. It will also increase client satisfaction by making these improvements. The program has a director, coordinator, and assistant. And of course, there are many volunteers who help out in the food pantry. It's important for the volunteers as well as the staff to have buy-in and believe in the cause in which they are involved. The organization has invested staff, time, vehicles for picking up food, technology, funding, food, training, research, volunteer recruiting in the Client Food Choice program. And the program is designed to follow that client choice model. However, as I said earlier, due to the limited space, we are not able to do that. And so this improvement would greatly affect the clients and the community in receiving the food options that they wish. So clients will receive what they want and will actually use, and there will be less waste and more satisfaction in the food that they bring home to their families. There will be a program improvement team, and they will meet and design how the evaluation process will be designed. The team will create surveys to be distributed to the frontline workers of the pantry, the management, the members of the advisory board, community partners, and especially the clients who actually use the food pantry. It is important to gain the perspective of those involved in the delivery and the experience of the program. Having buy-in from the agency and stakeholders will be a part of the evaluation process. Before launching the improvement plan, the evaluation process will include giving surveys to clients about their satisfaction with the program and identifying gaps in the program. The surveys will be conducted pre and post implementation of the program evaluation. The evaluation team will look for changes in data during this process. The team will discuss research bias to avoid this influencing the outcomes and the evaluation findings accuracy. This program evaluation has solid external validity. It has external validity because there are many other food pantries in Ada County with a very similar, if not the same, client population and operational issues. The external validity takes into consideration different cultures and diets, providing the types of food they desire. The other food pantries in the area will be serving the same clientele with the same nutritional and cultural needs. It has been argued that the quality of our experimentation, along with its societal relevance, might be augmented and extended by considering ways to enhance its generalizability to everyday life. This program evaluation also has internal validity. We can identify the dependent variable as increasing food choice and accessibility for clients. The independent variable would be the client satisfaction and more choices of foods and better access by expanding the hours and days that the food pantry is open. So it has internal validity because increasing food choice and accessibility to pick up the food that they want. This will improve client and program satisfaction and give the clients more choice and options and access to the food pantry. So this is my logic model. As you can see, everything is outlined. And the important priorities are to provide for low-income populations. Another priority is our hours of operation, food choice, and accessibility. We have short-term, intermediate, and long-term goals. For example, a short-term goal is to increase awareness about the program and the changes, and that would be done through media and other avenues. And then we would plan for the implementation of the program improvement. An intermediate goal would be to initiate the program and get the client signed up, excuse me. A long-term goal would be to implement the written plan and test out the hours that we have changed. And another long-term goal is that clients will have more choice and accessibility, and this will create a healthier community. The positionality of the design program eval is a critical factor. The author of the program is currently a family services case manager at the Salvation Army Corps Boise. As a part of the family services team, the case manager works with the director of the food pantry, but not directly with her. The case manager has occasionally helped in the food pantry and has observed daily operations. Additionally, the case manager's clients also use the pantry and they give feedback. The researcher of this program evaluation was aware to mitigate any bias throughout the evaluation process. Throughout this process, the researcher attempted to take a neutral and unbiased observation. The researcher approached the program evaluation and did not give any personal opinions. Additionally, the researcher took no credit for the evaluation, analysis of data, or study design. The researcher decided to do an in-depth look at the Client Choice Food Pantry program. Because the researcher does not work in the food pantry program, there were few preconceived notions about it. The researcher care was taken in investigating the details of the program, its areas that could be improved, and the evaluation of the program. Since the researcher does case management with low-income families, she has a background in the issues that this population faces. The researcher is a middle-class, educated white female in her 50s, which influenced her position in this program evaluation. In conclusion, the food pantry can be improved to optimize food choice, nutrition, and accessibility to the clients it serves. By implementing the improvement of the Salvation Army Client Food Choice Program, we can do all of these things. The improvement plan includes moving to a space that can support client choice in their food options. The plan also offers expanded hours for individuals, families, and even seniors. Food is a basic need for all humans. It should be easy for people to access and to give them choices. Improving the Client Choice Program will ease the stress that clients feel to acquire the food they want and need, and also to offer more convenient pickup times. Improving the Client Choice Food Pantry Program will benefit our community and help people live healthier and less stressful lives. These are my references, and I thank you very much for listening to my presentation.